Hey, I'm Dr. Jerry Williams, and I'm here to talk to you about what to do if you've been in a motor vehicle accident. No, I'm not going to tell you need to call your attorney. What I am going to tell you is that there are some things that you should do to make sure that you and your passengers are taken care of appropriately, because it's obviously an upsetting time when you've been in an accident and you might not make the best decisions in that moment. So let me give you some information and give you some advice, and hopefully you're not going to be involved in this situation. But if you are, you'll make better decisions. So frequently we'll see patients at urgent care 24/7 nationally, and we'll see them a day or two or three later, and the patients will tell us that they quote unquote refused medical treatment at the scene. Now, just because you're offered an opportunity to get in the ambulance and go to the hospital doesn't mean you should. If you truly feel like you're all right and you don't need to be seen in the emergency room, don't go. It's a very expensive and very inefficient way to get care. And so if you don't feel that you need to be seen in the emergency department, just politely tell the paramedic or the police officer that you'll go get checked with your primary care provider or at an urgent care. But we always recommend, regardless of how minor the accident may be, that you just go and get checked out, because that creates a baseline. And the reason that baseline is important is because so frequently we see patients that will tell us that they thought they were okay on the scene, and the next day they can't get out of bed, or the next day they've got incredible pain and incredible symptoms, and they wished they would have been evaluated at the time of the accident. So I want to encourage you that the stiff upper lip and trying to be strong in that post accident environment is an admirable quality, but put all heroics aside and go get seen either in an emergency department if you think that you've got a serious enough injury that would warrant that. But at the very least, go get seen in an urgent care center or with your primary care provider within 12 to 24 hours after the accident, and make sure that everything's all right. And you'll sleep better. And if you do have problems down the road, you will have documented any potential injury early on in the immediate aftermath after the accident. So I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.